I'm from the University of Limerick. I'm also got a joint appointment with the University of Limerick Hospital Group. So this partnership is quite unique because it's a partnership within a partnership. So we've got a group consisting of people from UL, University of Limerick, and the University of Limerick Hospital Group. And our partnership, which, speaking about very young partnerships, is extremely young, just since July, we went on a visit, is with the Upper West region of Ghana, with the capital of Wa. So we went there for a week in July, and a lot of people have said this about some of the countries in Africa, but very high maternal mortality, neonatal mortality, life expectancy 61, which has increased actually over the last 20 years or so, problems with communicable diseases and non-communicable diseases as the population is aging. The big thing about Wa is it's 5 hours from the nearest airport and the nearest tertiary hospital and medical school over very rough ground, and it has a very large rural community with very little hospital provision. So it's got unique challenges. So, this is us looking rather tense on our best behaviour, because this is us with the King of Wa we got. So, not many of you can boast an audience with the King of Wa, so we've been to Wa, but you can see we're all a bit tense right here. Like this. Didn't want to offend him. So yeah, we had a great week. We met loads and loads of people, did lots of talking to people, exploring hospitals, looking at the health services, really, really investigating the provision of care in Ghana, in this part of Ghana. So I'm just going to tell you what happened and then what our plans are next. It's very impressive. Aspects of healthcare in Ghana were impressive because the healthcare is organised to serve the needs of the community. So you have little compounds, community health compounds, located all over the region to serve community needs and population needs. So that was impressive. But there were major problems, and these relate to infrastructure, transportation between the rural areas and the hospitals, and very rudimentary education and training. Now, in a sense, I feel a bit bad about saying that, because actually nurse and medical training is actually very well developed, extremely well developed. But it's just the continuous training, ongoing, in-service training that was lacking. If you go into the wards there, because I'm a nurse by trade, shortages, generators don't work, no infusion stands, no sheets, no dynamaps, no stethoscopes, very little thermometers. So the resources are very scarce there. They were extremely welcome. They welcomed us. They were hospitable, but they were very clear what they wanted, which was great. So they told us what they wanted, and we listened, really. Their priority areas is education and training of healthcare staff. That was their main priority area. So our next steps, we've gone back to the University of Limerick and the University of Limerick Hospital Group, and we've got buy-in from the president of the university and the CEO of the hospital group. So that's a kind of strategic thing we needed to identify and obtain, so we've done that. We've identified a partnership lead in Ghana to help drive momentum there. We're developing a working group now at the University of Limerick and the hospital group. We've called it the Friends of Ghana, not very original. We're going to go for NGO status, and we're going to begin fundraising. We've completed the needs assessment along with our partnership leads in Ghana of the health needs in the Upper West region. That's been completed. We've identified, or rather they've identified for us, their areas of need, which is in pre-hospital and hospital provision, because the issue there is people are dying out in the communities before they can be transported into the hospitals. So pre-hospital provision was lacking. And our plans, this is our master plan, depending on funding, etc. We're hoping to provide an in-country, back-to-our training symposium on neonatal resuscitation, and we'll definitely be in touch with Tony, because I think it's helping Helping babies breathe is the obvious thing. And we're aiming to train the trainers to disseminate the training out. And that's it.